Hello everyone, welcome to this series of podcasts, I and You, where we discuss everything about ophthalmology and life, and we get to know the person behind the ophthalmologist. So we just want to speak with you and want to know your journey and the person behind ophthalmology. When you came back from the US and you were starting at looking into your career and as practice in ophthalmology, what was refractive surgery as a scenario in India? How advanced were we compared to the West? And how did it change once you entered? And how did you play a role in refractive surgery?
Well, I don't know whether a lot of people know, especially I don't think normal individuals would know that the khahish or the ichha to be without spectacles and ophthalmologist trying to get there is more than a century old. So it started way back, and then among the first things in 1930 in Japan, Sato was giving small little incisions within the cornea, but then came in the incisions for outside the cornea, and that was popularized by a Russian doctor called Fedorov. And just to tell you that this is how what the main idea was to change the shape of the cornea. So जैसे आपको बताया ये कॉर्निया है सामने, छोड़ ये कॉर्निया है सामने. सो कॉर्निया का अगर हम आकार बदल दें या कर्वेचर बदल दें तो लाइट जो है वो कॉर्निया, अगर पहले आपका ये जैसे कॉर्निया है, अगर ये कॉर्निया ज़्यादा स्टीप है तो ये ज़्यादा इसमें पावर होगी. अगर हम इसको फ्लैट कर देते हैं तो इसकी पावर कम हो जाती है और लाइट जो है मायोपिया के अंदर वो रेटिना के ऊपर आ जाती है. सो कॉर्निया के ऊपर प्ले करना was something which was important, and that was what was looked at by various people. And India, even before I went to US, this was called as radial keratotomy. That was being practiced in India, and I was also doing it. I was not very convinced about the technology. I had my doubts, and that was because the wound healing was not predictable. And later in life, as we are seeing even now, there is a drift in the number, which is called as a hyperopic shift, which was happening. And I also worked on the wound healing assisted by confocal microscope, and we have certain publications when we were in US. So refractive surgery basically was not still practiced to that extent in the US. It was a Russian technique that came. Then there was an American modification, and we were doing it in India in the form of radial keratotomy.